Hello, it's Jael here. I hope you guys are doing well in this MCO. The reason why I made this video is because one of the FB so-called artists, famous FB girl, shared her experiences with scoliosis surgery that she recently do lah. I realized her video has very minimal insights about the whole process of it all. So there's really nothing much to take away from what she's saying. And as you guys know lah, I had scoliosis when I was 12, and I was diagnosed back then when I had to do the back bending test where they ask you to bend the back, and then the nurse would like measure whether your back is even or not. So if it's not even, you have scoliosis lah. And I had minimal symptoms back then because nothing much. But like when I reached high school, I started experiencing the abdominal pain, like very slight discomfort. So I tried a lot of treating methods. My parents brought me to a lot of treating methods. Like one of them is tried chiropractic, where like they claim that because your back muscles are uneven, like one side of the muscle is pulling the spine to the other side, which is, I don't know whether it's right or not, but their methods doesn't really work. They tried using the electrical methods to help stimulate one side of my muscles to make it stronger, so that you pull even out the muscles, and then the spine will adjust accordingly. But it didn't work, so I tried a lot of things and it didn't work for me. One of the more effective ways is I tried braces also. I tried this in high school, you know. Like I have to put on, I wore this to school and shit. The way you put it, just strap on your back like this. Yeah, I couldn't fit now because it's in high school. But yeah, I tried this, I wore this to high school and shit. And you're supposed to wear this. This was the advice given to a doctor, by the way. So you have to wear this to sleep, you have to wear this to school. Basically very long hours. I found it very hard to do it because when I sleep, right, I can't control myself, you know. When I went to sleep, I was wearing it, but when I woke up, it's just gone because I just took it off by instinct. So I didn't have the discipline to do that, you know. And it helps slow down the progression of scoliosis when I did put it on, but you can stop wearing it as soon as your puberty stops, and I thought my puberty stopped, so I just took it off. But as soon as I took off, the curvature just started to just go haywire, and it just worsened a lot. So like my advice to you guys who are wearing braces now is just to wear it all the time, be disciplined, don't fuck it up like me, and be committed 100%. Until your puberty 100% stop, when you take it off. So now I think I'll just go to the juicy part, which is the operation itself. So there's actually different measures towards scoliosis. The way you measure it, so you can see here, right, there's one 55 degrees and 28 degrees. How you measure angles is just drawing two lines based on the joints. You see the segments in between the spines. Yeah, you take the greatest angle between two curved parts, and then you just draw it, extend it. So when the two lines meet, that's the angle of your curvature. You need to take the biggest angle to you don't take the more smaller angle, you take the biggest angle possible, you know. Okay, so after you take the angle, if your angle is this angle taken is taken from the doctor lah. You're not supposed to do it yourself, because I'm just elaborating on how they do it lah. So if the angle is greater than 45 degrees, you have to do operation, because even after your puberty completes, it's gonna worsen by 1 degree every single year. So you're fucked lah, basically. You're getting more and more curved every single day until you're old. But if the angle is less than 45 degrees, your curvature won't worsen as much, and you don't need to take surgery. That's what the doctor told me. It's not what I'm saying now, okay? So that's what the doctor who operated on me said. So if your angle is less than 45 degrees, you don't need to do the operation. So it's very important to prevent your curvature from reaching over 45 degrees. Like you wear braces, you do whatever you can just to not make it exceed 45 degrees, so you don't have to do operation. Not like what I had to go through. I'll just jump to the operation itself right now. The operator the doctor in charge of my operation, it's carried out in Universiti in Malaysia Specialist Centre UMSC. So this doctor is it's number one scoliosis doctor in Malaysia, honestly. So he averages around like one case of surgery each day for scoliosis itself. It's the same doctor as the FB, the Facebook artist that I mentioned earlier. She also did the same operation with the doctor. So what you do is just insert screws and rods into your spine and then you tighten it, but so the curvature doesn't worsen. The funny thing is like the cost of all these screws and rods, it's like even more than the charges that the doctor take, you know, like the equipment, the rods in your spine is even more than what the doctor charges. It's very important to ensure that insurance covers this. It's not cheap, but it's 38,000 for me. So my insurance covers most of it, thankfully. So after the operation, I had screws and my movement is very very stiff, honestly now, because like half of my spine, more than half, is just fixed there. I can't bend there, you know. So you can only bend your lower parts or upper parts to make up for that restricted movement of your operated. So your unoperated parts, right, they have to make up for the movement, you know. So they have to move more than usual and they take more stress, you know. So one good thing is that because most of your spine is fixated, your sitting posture is good because you can't bend, you know. So I'm always like that. I can't really bend. So I can only bend my lower back, actually. But a very bad thing is like because your unoperated joints are you need to move much more, you know. So it's very important to build back muscles to support these areas because it's easily gonna be damaged. You have to build back muscles to support your lower back also. So back exercise is an absolute must. The doctor will brief everything on this also. So the rods are there. You can do any exercise you want, you know. So like gym exercises, weights, everything you can do everything just to strengthen your back muscles. So the rods are there until you're dead lah, basically. So it's not gonna remove, it's just gonna stay there. Alright, now I'll move to the juiciest part of the actual operation experience itself. So 24 hours before, you do a lot of scans, MRI scan, CT scan, blood tests, standard stuff lah, detect your nerve, sickness, everything. So the MRI scan was absolute hell for me lah. So what they ask you to do is like, they ask you to lie down and then flat, right, and then you put like pillows under your legs, so your legs is like inclined, you know. The blood will be flowing away from your legs to your body, and your legs will feel very very numb. And you like sit there for 40 minutes, so the numbness just stays there and you're not supposed to move because they are scanning your body. So that was hell for me, man, because you can feel your legs getting more and more numb. Holy shit, I'm not gonna experience that shit again. In a sense, it's even worse than actual operation for me. And the staff there is actually very very friendly. Everyone's so friendly there. In fact, like when I was in the operation theatre itself, the guy asked me like, did you sleep well last night? And I replied to him, no lah, I every day game till 3 a.m. They asked me to sleep at 12 a.m. I really couldn't sleep, you know. I just stared at the ceiling. And then the day in operation, I haven't really slept much. So he just laughed, and then within 1 minute, cause the guy's in charge of the sedation, I just passed out within 1 minute after he gave me the sedation. I didn't even know how I passed. Suddenly I fell asleep. So. And then during the operation, right, they actually like WhatsApp your parents the whole progress of the operation, 10 of 10 service. So it's like, 60% complete, the blood loss is how much, or like that. It's very detailed. Holy shit. Post-op, okay. So you might think like when you operate your back, right, you're supposed to sleep like face lying down like that. But no lah, you face like you sleep like normal. You sleep your back facing the bed and then your face sitting up. So no need to just lie on your bed, lie on your front or something. No. The first day the pain relievers are doing their job and you don't really feel much pain. The second day only you feel the soreness. It's very very tough initially. The muscles are going to be very very sore, so like normally you would think like you raise your arms, it doesn't relate to the back. I know, when you raise your arms your whole back is sore. So I couldn't raise my arms like that. I couldn't even do this. I the most I can do is like that. Literally, I couldn't. So I had to take like 12 plus pills a single day for the pain relievers, everything, antibiotics, everything. And you have your urine pipe inserted into you, so you don't need to walk to the toilet. So in the third day, you're asked to walk. Actually, you're heavily pressured to walk, right? And everyone doesn't like you lying down because your back is very stiff. You need to walk to make it less stiff, in a sense, to stretch them out. You have to walk to use the toilet. You have to walk around the corridor to relax to stretch your back muscles a bit, because you're going to be very stiff. You're literally going to walk like a puppet. Like, the whole time I was like this, like you couldn't bend, like this. You're seeing like this also. The nurses actually laugh, so they say it's like a patong, the doll. And yeah, it was alright. I pulled through. Your back muscle is gonna be screaming for help. Honestly, it's very very sore. There's actually an option for morphine just to use for pain relief and stuff, but I didn't use it because when you use morphine, like, you have the tendency to vomit, and because you haven't eaten any solid food, you vomit all those yellow fluids from your intestines. It's very very unpleasant, even worse than the pain itself. So I just skipped the morphine, the pain relief. I just didn't take the morphine pain relief. I just put through the pain. I didn't like vomiting at all, man. So like the doctor saw I use like so little morphine. He's like, you should use more. But I really didn't like the feeling of vomiting, so I just didn't. And yeah, after 4 days, you're free to discharge to go back home. I still couldn't bend my back. Honestly, I just sat there like a doll. And if you have ever tried going to a car without bending your back, it's very hard. When you go in the car, you go like that. It's you can't bend your back to get in the car. A lot of people stare at me when I try to get in the car in the hospital. Back at home, recovery at home is pretty straightforward. You have to still take antibiotic pills, you take supplements for your blood to regain back your blood. I take like 10 plus pills a day, which is fucked up. I do go to the toilet a lot of times in the day because the amount of water I swallowed for the pills, honestly. And the back muscles are very 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 sore. I couldn't even like reach my head when I'm showering. I couldn't reach here. Most I can do is like here only. Yeah, it's very fucked up. So my whole back was very very stiff. This carried out for about 2 months ish before I could reach my head. Before my arms could reach my head, because the back muscles are very very sore. Yeah, so I think that wraps up my sharing. I think if you guys have any questions, you can just ask in the comments. I will leave the links to my doctors and all the name cards and everything. I hope this video gave you some insights about scoliosis, because you never know, your relatives may have this, and if you can just link them this video. I hope it can help them to understand the process a little and all. Because lately, like, a lot of people really kena scoliosis. It's not a joke. So I really hope everyone goes through. So best of luck, and I hope you guys recover also if you have scoliosis. Okay, if you have any questions, leave in the comments below. Thank you.